This is a very old institution. It was started way back in the 1926 by an American missionary, George Ray Allen, who during those days, before his time, to come and start such a great institution, been very helpful to the people of this country, even other countries around. This hospital actually nowadays is a very big referral hospital. We have other health posts around, but we refer most of their major cases here to the hospital. And basically, we have a lot of service options. We do inpatient and outpatient services. We do general surgery. We have the eye care service. We have the dental clinic. And fortunately enough, we have a program that is just about to be born so that there can be even a dental training program which will be incorporated into the School of Nursing, hopefully. And we are expecting even a visitor to come in tomorrow into the country with regards to that. The hospital, besides what we do in the main hospital that I just mentioned, we do a lot of outreach programs in the communities. And prominent among them now is what we call the Child Survival Project, which has been sponsored through our partnership with Q America Global. They have been sponsoring this project. It's a 5-year project. And basically, it's not the main hospital, it's out into the communities where they go and do a lot of medical services. And this project is exceedingly well. They're doing well, and we are hopeful that with the assistance that we are getting, we'll actually get to promote the hospital. And indeed, it is promoting the hospital in many ways, because nowadays there are a lot of influx of patients coming to the hospital because this project is out in the various communities, and people take advantage of that to come to the hospital. And besides that, we have what we call a diabetes program, which is also a pilot project. This project just started this year. It's a 2-year pilot project. And we are in partnership with the World Diabetes Project. So hopefully we hope that after the pilot period, this project will get a stay. And in fact, they intend to use Ghana Hospital as a diabetes center for the whole of this country, the Republic of Liberia. So we are hoping that at the end of the 2 years, this project can be passed on. We are also doing, like I said, the eye service. I'm sorry we didn't have much time to visit that, but it's a self-contained unit of the hospital. They have a 20-bed facility where they do a lot of eye disease conditions, a lot of cataracts operations. They, like the other primary health projects, they go out into the community to census, and the people that have eye problems, they come there and they are treated. And of course, like I said, the main hospital itself, I went through a very serious problem. Most of these projects that I just mentioned have some external funding help, assistance, donor nations are helping, but the main hospital itself does not really have, per se nowadays, any real funding. For example, coming from the states, like the way it used to be in the past, when you have white missionaries serving in these institutions. Like at the hospital, it used to be run by white missionary doctors, but nowadays we have black doctors, and the support that used to be is no longer. And of course, given the trend into this global financial crisis, people have their own problems, individual problems at home, so the support is no longer the way it used to be. And from the government end, we do get a little subsidy, and that little subsidy does not even come in time. So the main hospital is actually, facing facing a lot of serious financial problems. And if you are running a hospital of this nature, where you need to have fuel oil, for example, to run your generators, and there's not regular source of income for fuel oil, then you have a problem. You have to buy drugs, you got to buy other medical supplies, you have to buy equipment, and of course, you got to pay your staff. The hospital presently has a staff population of about 260, 3 medical doctors, and about 36 nurses, and about 54 nurse aides. A lot of the others are support staff. So it even becomes a problem when the money comes to an end, you begin to think about how to pay your employees. So we are saying that though the hospital is doing well, but there's a need to have some real help actually coming from the government, whose responsibility it is to actually care for the citizens. But the church, like I said, from 1926 has been carrying out that responsibility. And the point has come now that actually people who come into the hospital because of their poor economic background, some of them cannot even afford to pay for their medical bills. But yet still, we do not close doors on them, simply because this is a church institution. And the man who started the institution started on a charitable basis. So there are moments we keep piling up bills that are unpaid simply because our customers are not financially able to pay their bills. So when it comes to it, in short, we have quite a number of challenges. We have drugs and medical supplies is a serious challenge. We have need of fuel to keep our standby generators going, to meet payrolls, etc., etc. So I don't know whether you have questions, specific questions that you want to ask about the hospital, then I could address.